This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning, everybody. I think we've probably all heard the saying GCS of 8, you got to intubate, kind of the general idea that if people have low GCS, altered mental status to a certain point, they might need to be intubated to kind of protect their airway. And there haven't really been a lot of good studies to look at this, and there was an interesting idea recently. Someone had to actually randomize people with possible overdoses to whether they need to get intubated or not, something that we typically don't study in a randomized trial. This was done in France in 20 different emergency departments and one ICU, and the idea was, if patients had a GCS of less than 9 and they were suspected overdose or some kind of poisoning, they would be randomized to the conventional care like intubate if the providers thought they needed to be intubated, or the intervention was kind of less intubation, only intubate under certain strict conditions, including seizure, kind of persistent hypoxia, shock, so like not just because they were too altered. And what they looked at was overall death, length of ICU stay, length of hospital stay, and they looked at complications. And what they found was that there really was a difference in how patients were managed. In the conventional group, just intubate if you want, about 60% of patients got intubated. And then in the more restrictive intubation, it was only about 16%, so a lot less intubations. And they found that patients who didn't get intubated as much did better. There were no deaths in either group, so there was no difference, but there was shorter ICU stays, shorter hospital stays, less pneumonia, less adverse events if people didn't need to get intubated, which makes sense. So it's an interesting study to look at something that hasn't really been analyzed, and it kind of bottom line is maybe patients don't need to get intubated just because their GCS is low in this patient population, specifically overdoses. So maybe you can watch someone if they don't have one of those clear indications, if they're not profoundly hypoxic or vomiting in their airway, maybe they can be watched safely according to the study. Thanks, everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.